Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I am Kristen Stewart, 65 years.
Yeah, nice to meet you. How can I address you?
You can call me Kristen.
Okay, Mrs. Kristen. I have got a letter from your GP saying that you have high level of cholesterol and also you have high blood sugar and high blood pressure. Is it right?
Yes, doctor, that's right.
Okay. So I'm going to take detailed history and all the information during your discussion will be remain confidential. So is that okay for you?
Yes, doctor, okay.
So can you please tell me in more details how far do you know about?
Sorry, can you please tell again?
Can you please tell me in more details how far do you know about your condition?
Yes, doctor, actually, uh, I have been a patient of diabetes for quite a long time, actually. Okay, that was around 7 years back when I was diagnosed as having diabetes. Okay, and also over the years, I had some complications, like I had some problems with my vision. So I went to the eye doctor, and he gave me some therapy, laser therapy, and also I have some cloudiness of urine. However, that was found out recently, and since I also have some pressure issues, high blood pressure issues, the doctor gave me some, I think, Ramipril, I think, okay, and sorry, yes, some periondropil 4 milligram, and also some thiazide, okay. So I've been taking this, and for diabetes, I've been taking insulin and metformin, okay. Uh, However, I also have some raised cholesterol levels, and it is I think as far as I know, it's about 9 to 10, I think, this this cholesterol. But after having diagnosed as have more cholesterol, I was given some statin, but recently I just checked it again. The cholesterol level, it was still raised. It was still 7.5. So that's as far as I know about my condition. And so what to do? And since I had been taking insulin, I must tell you, in the last visit, since I have having some issues with my cholesterol and something like that, now I have been given a new drug named gliptin, I think. So that's what's going on with me. That's all I know.
Okay. So you have diabetes for a quite long time and you have also complication for that, eye complication, kidney complication. And are
Yeah.
you taking those medication for diabetes regularly?
Yes, I'm more or less regular, doctor. More or less regular. But there are actually quite a few drugs that I have to take. So at times I get a bit forgetful. At times, I think, but I try to maintain it.
And do you visit your eye doctor, heart doctor, and kidney doctor regularly?
Yes, quite regularly.
And do you know your last HbA1c level?
Uh, Doctor, last one, I think it was much increased, doctor. I think it was around 10.
Okay. And I am asking that is there any issue that you can why you cannot take your medication regularly? Can you share?
No, no specific issues, doctor, but just the number of drugs are very more, I think. Sometimes I just forget. I just forget, nothing else.
I will keep it in my mind. Have you ever felt any side effect due to this medication? Any loss of consciousness?
No, doctor, I have felt so.
Any changes in the skin for insulin?
No, doctor.
Okay. And you also have high blood pressure. For that, you are
Yes.
taking medication. Is it
Yes.
is your blood pressure under control?
I think it's more or less under control now, doctor. The last pressure, I think I measured, it was 130 by 80. So I think it's more or less under control.
And have you ever needed any recent changes in the medication?
No, doctor. No recent changes, but I told you that recently doctor has prescribed me gliptin.
Sorry.
Some gliptin for my diabetes. Gliptin, I think.
Okay, okay. And now I am coming to your cholesterol issue. For how long you are taking those statin tablets?
Yeah, I have been taking it for quite a long time now, doctor, and I think it's around 2 years now. I've been taking these tablets.
Do you take those tablets regularly?
Yes, I take those tablets regularly. I am quite conscious about my health, so I take these drugs regularly.
And have you ever noticed any side effects due to this medication, like any pain in your tummy, any yellowish discoloration of your skin or water?
No, no, but the doctor also told me about it that it can occur, but I never felt this.
Okay, that is fine. And may I know that about your dietary habit? Do you take any special diet or any high food?
Doctor, I have been gaining some weight recently for the last 1 or 2 years, I think, and I want to have some healthy diet. Okay, I feel that diet is very important for a person. So I have 3 meals per day. In the breakfast, I usually have some cereal and some toast, sometimes buttered toast, and in the lunch, I have bread butter with soup. And at dinner, I usually have some vegetables, at times some potatoes and meat. In between also I have some snacks.
Did you ever visit any dietitian?
Well, the doctor in the last visit told me that it will be better if I visited a dietitian, but I have read in the newspapers that actually these dietitian, there's keto diets, and there are some diet programs. These are actually harmful, so I didn't need to go. I think that healthy diet is what I need.
Okay, I'm sorry to hear that. And actually, dietitian will be very helpful in this regard, and we will try our. They will try their best to give you the good diet chart that is necessary for this condition. Is it okay if we
Okay.
make an arrangement with the dietitian?
Well, is it a must, doctor? I
Uh,
don't like this diet.
actually, I can understand that you are can understand your concern, but as your diabetes isn't under control and also your cholesterol is high, so at this point, the dietitian advice from the dietitian will be a good option.
Okay.
And may I know that about your lifestyle? Do you exercise regularly?
Uh, I try, but usually around 20 minutes for 2 or 3 days. I think I walk in the park, but I don't get so much time. I'm a busy man. I have some own business, and I usually can't manage so much time.
Okay, and I am going to ask you a few more personal questions. That do you have any headache?
No,
Any reaction in your body?
no,
How about your appetite?
it's good, doctor.
And you said that you have gained a few kg weight. And do you know your it's called BMI, body mass index?
No, I don't know it, doctor.
Okay, that's not a problem. And do you have any weather preferences? Any hot or cold preferences?
No, doctor.
Do you have any chest pain?
No,
Any cough?
no,
Any shortness of breath?
no.
Okay, any lumps or bumps anywhere in your body?
I haven't found.
Any joint pain?
No,
Any swelling of legs?
No.
Have you ever done the test for your kidney?
Yes, I told you that there was some frothiness, or the doctor told me that I have some problems. Some protein is getting away from my kidney. So he prescribed me periandropin.
And apart from your high blood sugar, high blood pressure, and high cholesterol, do you have any other disease or any other condition that you would like to share?
I don't know, doctor.
That is not a problem. And can I see your drug list?
Yes, you can see.
Do you take
It's
any other medication, any herbal products, any over-the-counter medication?
no,
Okay. And do you have any allergy to any medication?
no,
And at this point, may I know that any of your family member have this type of condition?
no. My mother had a heart attack. It was when she was 7.
Any of your family member have high blood cholesterol level?
Well, I don't know.
That is not a problem. And may I ask you a few more personal questions?
Yes,
Do you drink alcohol?
uh, sometimes. Doctor.
And any binge drinking?
No.
Can you tell me that how much do you drink?
Yeah, it can be usually in a week. I think 8 to 10 pints.
And I can understand that, but this is a quite high level, so it may also related to your high cholesterol level. And for this, I will advise you to stop drinking totally. And if you need help, I can refer you to the drinking cessation clinic. Is it okay?
Okay.
And do you
Yes.
smoke
Okay.
cigarette? Do you smoke cigarette?
No.
That is fine. May I know that what do you do for living?
Well, I'm now a retired person, doctor.
And do you drive?
No,
That is fine. And whom do you live with?
I live with my husband.
And do you think that do you need any social support or any other support?
No, doctor. I think I'm well supported.
Do you want to add anything else at this point?
No, doctor. Why is this cholesterol level not under control and my diabetes is not under control? So I have heard that it can cause heart attacks. Is it true? What can I do?
Actually, at this point, I need to examine, then I could give you the best explanation. But as I have taken your history, there are quite a few points that may related to your condition. We will check your insulin taking technique. Okay.
Okay.
And
Mm.
after that we will find out if there is any problem. Sometimes for that diabetes may not be controlled, and also there are some few other factors that your I think involvement of the dietitian will help you to get better food that is for helpful for both your diabetes and for your cholesterol level. And also that cutting down or totally stopping alcohol will be helpful. Sometimes taking alcohol increases the cholesterol level. So stopping alcohol may improve your condition better. And also exercise program, you also need that. Some exercise also helps to lower the blood sugar level and also lower the cholesterol level. Time up.
Okay.
Do you have any other question?
No, well, I don't have any questions, but I told you that what is the risk of actually this heart attack here?
There are quite a lot of risks that you have high cholesterol level and also high uh, blood sugar level. There are risk factors, and also you have ACE, that is also another risk factors. And with this, having high blood pressure, these are the risk factors for the heart attack. We will try to.
Okay. 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 Okay.
Okay.
Okay, well, so what is your diagnosis here? What do you think the patient is suffering from?
Okay, as her high cholesterol level, I think there are quite a few possibilities that she is taking much alcohol, and also I think that her uncontrolled diabetes is also some contributing to this. Other than this, there are few possibilities like primary hypercholesterolemia, familial hypercholesterolemia, that can be also another possibility. And
Well, if you
another
consider
thing,
familial hypercholesterolemia, okay,
and
you continue.
another thing I can I want to exclude that if she's actually taking those drugs, that is drugs compliance.
Okay, okay. So I think it can be termed as combined hyperlipidemia, okay, because it's polygenic and there are multifactorial risk factors present. Well, you told that it can be familial hypercholesterolemia. What would be the features then?
For familial hypercholesterolemia, there may be significant familial history, and also there maybe some xanthoma or xanthelasma
Okay.
that can be present.
And well, I think that there were okay. And do you think that you missed some points because in case of hypertriglyceridemia, familial hypertriglyceridemia, or familial hyperchylomicronemia, there can be pancreatitis, okay,
Yes.
and there can be some eruptive xanthomas, and so eruptive xanthomas, pancreatitis. So I think you could have been a bit more precise about asking these things, okay, that whether these are present or not. Okay, I think so. However, it was all right, and it was quite a clear cut case. So just about the counseling and all those parts are important. And another thing that what do you think can be the causes of hyperlipidemia?
For hyperlipidemia, the causes can be some liver disease, then hypothyroidism, then nephrotic syndrome, then diabetes mellitus.
Yes, yes. So for nephrotic syndrome, we got diabetes mellitus as a cause. Well, can you think of other causes?
For nephrotic syndrome,
Yes.
uh, okay, for
So
nephrotic,
that's you have heard well. You don't need to be bothered about it. Okay. So these are the causes actually that you should have been that are needed to be evaluated. And actually, you evaluated this you by asking about her water work. So it was okay. And I think you asked about some weight changes or weather preferences. I just forgot. Did you ask that?
I cannot remember.
Okay, I also forgot that whether you asked that hypothyroidism issues or not. And even chronic renal failure, I think, can cause hypercholesterolemia. Am I right?
Yes.
I think so. So that's all right. And I think that issues that familial hypercholesterolemia, history of sudden death, you could have been more precise by asking history of sudden death in the family. Sometimes there is just history of sudden death. Family members just don't care. Okay, but this can be a feature of familial hypercholesterolemia. And others have been more or less well covered, I think. So, do you want to add anything?
No, I have not much idea about this case.
Okay, so I think that's all. So the recording can be stopped.